Assalamualaikum dear doctors. In this video I am discussing a video station. So first we will watch the video, then I will discuss what type of question we can face in the exam. First question is that what I observe in this video, I can see a neonate who is grunting. The baby is pink in color and only a IV cannula is on her hand and there is no any oxygen. So my probable diagnosis is TTN. The baby is here 34 week of gestational age baby. So yesterday in Nepal there is a video station come that is a 37 week newborn baby with grunting and there is tachypnea present. So according to gestational age, the grunting or any tachypnea will give the differential diagnosis. And also on this video at the end there is a X-ray. The X-ray also showing there is fluid in the interlobar fissure, bilateral alveolar and interstitial edema, prominent pulmonary vascular pattern with increased perihilar markings and lung hyperinflation, which is the features of transient tachypnea of newborn. Now, what are the differential diagnosis of a respiratory distress newborn baby? The DDR according to preterm, term, full term. So if preterm we can tell that lung immaturity, that is decreased surfactant, we know. Other is pulmonary hypoplasia or other lung anomalies, congenital pneumonia, air leak, hypoglycemia, sepsis, persistent pulmonary hypertension, pneumothorax, polycythemia, congenital heart disease and heart failure, intraventricular hemorrhage, coronal atresia, neuromuscular disorder, respiratory center depression from maternal narcotics. And if full term, we can tell the DD like transient tachypnea of newborn, TTN, IDDM, sepsis, persistent pulmonary hypertension. Also, we can add their heart disease, congenital pneumonia, these are. And if post term, that is meconium aspiration syndrome and obstructed liver. Now, what history would like to ask in a respiratory distress newborn? So the history will ask, number 1, the onset course and durations, the response to oxygen and any fever. Then we also ask the prematurity, gestational age, mode of delivery, onset of fast breath, need resuscitation or not. Any respiratory support needed or medications. What type of respiratory support? What is the maximum saturation reached? Is the baby cyanosed or is he distressed? Then the any premature rupture of membrane, perinatal history of maternal drugs, especially narcotics, maternal diabetes mellitus, maternal infection, torque infection, maternal fever before or during labor and any antibiotics given and for how long. Then we will take the history of any fetal movements, any events during pregnancy or abnormal scan results, mother received steroid during pregnancy or not, any trial for NG tube, any family history of similar condition, consanguinity or infant deaths. Next, what is the examination we can do for this baby? So the examination for respiratory distress neonate is ABC, airway breathing and circulation, vital, especially the respiratory rate, blood pressure in 4 limbs, oxygen saturation, Apgar score. Skin examination for meconium staining, any associated anomalies, chest examination, cardiac examination. Next, what investigation we do for this grunting neonate? Number 1, lab we can do the full blood count, CRP, then thin or sphingomyelin ratio 2:1 to measure the lung maturity, urean electrolyte and creatinine, blood glucose level and culture sensitivity. Imaging we do the chest x-ray, echo, brain ultrasound and fundoscopy. Management, how can we manage? Manage first ABC, then ventilatory support, CPAP, avoid mechanical ventilation as it increase the BPD, IV fluids and surfactant according to need. And according to diagnosis, we give the treatment. The common organism responsible for the respiratory distress in neonatal, we know that Streptococcus, Listeria monocytogen and E. coli. Now, how can follow-up of this neonate? So the follow-up are the head circumference, then retinopathy of prematurity, hearing assessment, measurement and plot on preterm chart, neurodevelopmental assessment and follow sucking reflex, advise the mother regarding vaccination, especially the palivizumab. So this is all about this respiratory distress neonate. This also can become as a meconium aspiration syndrome. I will send the video on the comment box. So all the neonate with any respiratory distress showing, we can apply this video station. Please do subscribe and share. MRCPCH with Dr. Ima. Thank you.